Hey, I'm Dr. Laut. I am here tonight to talk to you about your feet with diabetes. We have a large group practice we're now hospital employees, but I've been doing this for quite a number of years here in the community. On any given day, we have 20 or 30 people in the hospital that are trying to lose parts or limbs from diabetes. And that's quite a number of them. So I have a large group and we cover the hospital. So the purpose of this is to try to prevent anyone watching this from being one of those people on my list that I have to see tonight or tomorrow. There's certain things that happen when you're diabetic, and the most common cause that leads to amputation is a loss of protective sensation in your feet. So the example I use is if you bought a new pair of shoes years ago and you put them on and you walked for a while and you got a blister on your little toe, you could hardly stand it, you couldn't wait to get the shoes off. But the people we see will come in with actually sometimes bones sticking out of their feet. And in order to get that bad, they've had to lose a lot of sensation. The problem is that if you lose this sensation, you won't really feel it. You won't wake up one day and say, hey, I don't have any feeling in my feet, like when your foot falls asleep if you sit on it. That, of course, usually comes back pretty quickly. The problem is that this will happen very gradually, and you'll think you can feel it. A good example of this that I use is a guy that I saw in the hospital some years ago. I went up to see him, and all of the skin was gone from his ankles all the way to his toes on both feet. So I looked at him for a second. I said, oh, you burned yourself. And he looks at me and he says, that water wasn't too hot. I'd known he burned himself because of the pattern of the injury, as it was the same on both feet. And I said to him, I says, you're in the hospital. I said, of course it was too hot. And then he kind of had to agree with me with that. So it's an unusual problem, and people that have diabetes, some doctors think they're stupid, but that's really not fair. They just can't feel what they used to feel. So lots of things will happen. So somebody will put in the hospital, they typically have like a blood sugar of 300, 400, feeling like they have the flu, vomiting, stripe in their leg, pus coming out, bones sticking out, and they'll have had that. When I ask them, they relate having it for about 2 weeks or a week or two, and they just didn't want to bother me. So that's how they end up getting sick enough to end up in the hospital. Or they'll come in through the emergency room and then we'll get called, and then we'll ask them the same question, like, why didn't you call? I don't want to bother you. Well, now you're bothering me because it's late at night and now I'm looking at you. So let's not do that. Let's prevent this. So one of the things we stress is you need to check your feet every day as a diabetic. You can have your wife or girlfriend or boyfriend, whoever, check your feet, that's fine, but make sure they can actually see. So we have lots of incidents where there's somebody's spouse is legally blind. So what you want to do is, I usually tell people if they're doing it yourself to do it in bed, because you don't have to bend over very far. You can, get to your top of your foot, spread your toes, check the bottoms. You're looking for rub spots. Certainly if you see something like a hole in it, that's a bad sign. Don't put your head in the sand, wait for the 2 weeks, because that's only going to get worse. So once you do that, if you see something you don't like, maybe it's just a red spot on your foot, you don't have to go crazy over that, but you look at it the next day. Is it getting better? Is it getting worse? Is it still there? If it's not going away in a few days and there's nothing else really causing it to rub, then you should probably call somebody, which is a good idea. Since you may not be able to feel how serious this is, it can get out of hand in a hurry. So once you get a break in the skin, germs live on your skin. That's why we wash you with all kinds of chemicals before we operate on you, because we're trying to limit the number of germs that are there. So any break in the skin can produce an infection. One of the problems we'll see with infections in diabetics is that once this starts going, the bacteria start to multiply. Your sugar gets harder to control. When your sugar is harder to control because of the infection, your immune system is inhibited from attacking the germs as easily. So it's a cycle that occurs, and you tend to get sicker pretty fast. It only takes the germs 8 hours to make a whole generation, so unlike us for 20 years or so, that's a big difference. So anyway, check those feet every night. If you come to my office or we come to Better Health clinics, we have ways we check them here. They're pretty simple, like a fishing line that bends at a certain pressure, tuning fork that can check for vibration. All these things are easy to test and screen. So the loss of protective sensation is probably the single biggest factor that starts the ulceration. People walk on calluses all the time. You know, you don't want to use things that have acid in them, like salicylic acid. They're made to eat away at tissue, but it doesn't know where good tissue and bad tissue, where the margin is. So you can actually cause an acid burn using some of these products, so we really dissuade you from doing that. If you get a callus, you may not really notice it unless you're looking at your feet. It's normal to have calluses on pressure points, but if they get too thick, they can push the blood and the tissue fluid away from the skin, and then the skin will die. If a crack forms in the skin, then the bacteria can climb in, and then that's frequently how we see people get ulcers. Other things that happen to patients, we always tell you check your shoes. You know, every day, just take your shoes off, look at the bottom, make sure you don't have roofing nails stuffed into the soles, because people do that all the time. They may not notice the clicking sound that they make or the sparks on the sidewalk, but you know, those are some other indicators you might pick up. Take your insoles out of your shoes if you have them that come out. Dump the shoes. Just make sure something didn't bounce off the floor and end up in your shoe, because that happens more often than you would think it would. These are all things that can cause ulcers. If you get a new pair of shoes, one of the important things to do is wear it for 10 minutes in the house. Don't wear it outside or you can't take them back. So wear it in the house, take it off, look for rub spots. You may not feel that they're uncomfortable. People will come in and say, I spent $200 on this pair of shoes. I said, and they were comfortable. I said, well, if you can't feel anything, all your shoes are comfortable. So you can't go by how you feel. So take them off, look at it, do it again later, and just see if there's any problem. If there is, they're not going to work for you, or we have to get them stretched out so at least you can use them. So that's a huge problem, is the loss of protective sensation. Another problem we deal with diabetics frequently is circulatory. So people that have diabetes tend to have diseases that occur in the artery, whether it's around the heart, it's in the leg. In any case, you're more prone to have arterial disease with diabetes. So some of the signs you might find with this would be if you go out walking and get cramps in your legs. Well, anybody can get a cramp, and a lot of people get cramps at night, but that's not the ones we're talking about. We're talking about cramps that occur while you walk. So if you walk, go out and walk, a patient will come in and will say, how far can you walk? And they won't really know how far they can walk. And you ask them if they can walk a couple blocks. Oh yeah, I can do that, but it turns out they haven't done that in years. So, or they didn't even think about it much. So you tell them to go outside, just walk down the sidewalk, a block, turn around and come back. If you stop and wave to the neighbor and talk, it doesn't count. You have to walk without stopping. You don't have to walk fast, just walk your regular speed. So if you find that all of a sudden my leg cramps up when I get by Mrs. Jones' house, you know, a few doors down, you have to stop and rest, go, keep going, and you'll find it happens again. This is important. That's called claudication, and your muscles not getting enough oxygen because the blood flow isn't enough to support it. So you'll see this happen at regular intervals. So you go out another day and you do it again, and you want to do that maybe 5-6 times in a couple weeks, and then we have you come back. How far can you walk? Oh, I can only walk 2 doors and I got to stop. That's important. When we examine you, I always put my hands on you, and we check for arteries. You can find pulses in your feet. There's 2 main arteries that feed each foot. God gave you 2, so if one's not working, the other one can take over. But I want to be able to feel those. If I can't feel those, that's concerning as well. We have a Doppler stethoscope we can use, and we can listen for the arterial sounds. And with that, it's much more sensitive. So if I'm concerned about your circulation, or you have symptoms of bad circulation, the test we'll send you for is a non-invasive arterial ultrasound. And what that involves is putting a blood pressure cuff on your arm, okay? If your systolic pressure is 120 here, and the same pressure is measured down here at 60 on your ankle, it tells you you're only getting half